We're now joined by Dr. Nicole Harris-Hollingsworth, who is the Vice President of Social Determinants of Health at Hackensack Meridian Health. Doctor, good to see you.
Good to see you as well, Steve.
You know, we've done so many segments on this topic, social determinants of health, but not convinced people know exactly what they are. Please share.
Well, the social determinants of health are all of the things that affect your health that are not clinical care. So where you live, how you live, where you shop, where you eat, what kind of transportation you take, the stress that you have in your life, everything that's just not impacted directly by the doctor's office is a social aspect of how you're cared for.
Talk to us about what needs to be done, what is being done, but the follow-up is what's not being done to address these social determinants of health.
Well, what is being done is really a building of awareness that there are all of these other factors that are impacting your life, and that there are things that people should be mindful of. In terms of what's not being done is really a sense of ownership of that. As people in general, we tend to be very sacrificial. We'll do something for someone else and completely neglect our own needs. What institutions like mine and others are really working on is making sure that as care providers, we're paying attention to those other needs and making sure that we help you with them. So it's not just, telling you to eat well, it's making sure that there's a supermarket in your community that has the foods that you need to eat the way that we're trying to get you to.
HMH is one of the healthcare organizations that support what we do, and I've also led a physician leadership academy there. I've taught in that for several years, and the issue of behavioral health comes up a lot. But when we started doing this work around social determinants of health, it wasn't being talked about as much as it is now, 2 years plus into the pandemic. Talk about behavioral health connected to social determinants of health, please, Doctor.
Right. So when Hackensack Meridian Health really locked into isolating our work on social determinants and social needs, we identified 5 key areas. Those 5 key areas include food security, housing stability, transportation access, caregiving support, and mental health, behavioral health, and substance use disorder. It's really the identification of those 5 core areas that have made the difference. Within the behavioral health space, we know that there is a linkage between that one and the other areas. So within behavioral health, we're working very closely to tie in specifically issues and concerns related to food. We know that food has an impact on behavior and on behavioral health resources. And we want to make sure that we're advancing how people are improving their psychological environment, their behavior, by making sure that, again, food resources are readily available. There's a presence of food deserts across the state, notably discussed in a range of publications. And what we have found is there's a strong correlation between lack of adequate food resources and the impacts that we're seeing in our behavioral health communities. So we're really working to tie those things together and to provide supports across those areas.
Doctor, the Community Food Bank of New Jersey and Fulfill New Jersey, we have a collaboration with the Community Food Bank of New Jersey to talk about food insecurity issues, to do greater more public awareness work around food insecurity issues and how people can help and make a difference. You have a collaboration with the Community Food Bank as well.
Yes. Yeah. I mean, when you mentioned them, I had to smile. The Community Food Bank of New Jersey and Fulfill New Jersey joined with us in partnership with the American Hospital Association's Hospital Community Collaborative, specifically to work on food. We've developed an alliance, which we've named the New Jersey Food Equity Collaborative, where we're working not only between ourselves as large organizations and as directors of individuals, connecting them to food resources, but absolutely working to partner with the range of food initiatives across the state of New Jersey. It's not just about us coming in and trying to create something new. We really want to make sure that our collective work aligns with the work that's happening across the state. We know that between our three organizations, we do have a tremendous amount of leverage in that we're touching so many different lives, and our ability to help other organizations become more effective with those populations, especially in getting people to know what organizations are out there, is a benefit we're looking to bring to both the food environment, but as mentioned, the behavioral health space as well.
Before I let you go on behavioral health, in the teaching that I've done at the Physician Leadership Academy at HMH, the issue of wellness comes up a lot. Dr. Amy Freeman, who leads that effort. And you may ask, what's the connection here? Well, I want to understand your perception and your perspective on this. So many healthcare professionals, nurses, physicians, other clinicians, frontline, the issues that they have regarding mental health and behavioral health issues, given the stress of this pandemic, huge. How does that connect your own people with social determinants of health?
You know, and I'm thinking of the best way to formulate this. You know, at HMH, and I'm sure all organizations have this at their core, but definitely at HMH, we have a series of core principles, one of which is connectedness. And we want to be connected to our team members to support that wellness. So as a network, we provided a range of resources and services. You know, we're entering now our third year of life in COVID. We know that our workforce, and again, like others across the state, are tremendously burdened by this. Yet as natural caregivers and those in the helping profession, as I mentioned earlier, they're last to help themselves. And so we want to make sure that they have access to these programs. Literally everything that we built for our communities, we've also built for our team members. That's what we call the folks that work here at HMH. And so connecting those team members to this broad range of resources. And importantly, we've made these resources very publicly available because people don't necessarily want to come to us and say like, hi, I'm having a problem. And so anyone, be they our team member or anyone across the state, can go to the Hackensack Meridian Health.org webpage. On the bottom of the page, yep, it's community resources. And they can put in the address that they live at in the state of New Jersey and get access to all of those resources, including behavioral health resources, wellness resources, exercise, meditation, yoga, and other activities.
Doctor, I wish we had more time, and most importantly, I cannot thank you enough. We appreciate Dr. Nicole Harris-Hollingsworth. The first time with us will not be the last time. Vice President, Social Determinants of Health at HMH Hackensack Meridian Health. Doctor, thanks so much. All the best to you.
Thank you so much for this opportunity.
You got it. We'll be right back.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by the Russell Berrie Foundation, Rowan University, NJM Insurance Group, Horizon Blue Cross Blue Shield of New Jersey, PSC&G, the Healthcare Foundation of New Jersey, the Robert Wood Johnson Foundation, the New Jersey Education Association, and by Fedway Associates, Inc. Promotional support provided by the New Jersey Business and Industry Association and by New Jersey Monthly.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders, the people who make our state a great place to call home. NJM, we've got New Jersey covered.